Hello guys, welcome to my channel SwathiPharmaJnan. Today's topic is classification of tetracyclines. For the introduction and SAR of tetracyclines, you check out for my previous video. Classification is based on duration of action. According to duration of action, there are three categories. One is long-acting tetracyclines, which will show the action duration of action for 12 to 16 hours, which shows examples of long-acting tetracyclines are doxycycline, minocycline, meclocycline. Intermediate acting tetracyclines are the drugs which will show the duration of action for 8 to 12 hours. The examples under intermediate acting tetracyclines are demeclocycline, mithacycline. Short acting tetracyclines are the tetracyclines which will show the action for 6 to 8 hours. Examples are the basic tetracycline structure, chlortetracycline and oxytetracycline. Tetracyclines are obtained from various species of Streptomyces species of bacteria by fermentation technology. This is the general structure of tetracyclines. We have discussed in detail about this general structure of tetracyclines during SAR of tetracyclines. So four cyclic compounds are present. That's why they are called as tetra. Tetra indicates four, cyclines indicates cyclic compounds are present, A, B, C and D. The numbering starts from here. Ketone group is present at first position, second position amide group is present, and at third position there is a hydroxyl group is present, and at fourth position there is dimethyl amino group. At fifth position it may be a variation or for any alkyl group may be present, and at sixth position there is R2 and R3, and at seventh position there is R1. 8, 9 position it should be non-substituted to show the good antibacterial activity. 10th position hydroxy group is present, and at 11th position there is a ketone group. 12th position one more hydroxy group is present. Between 12th position and first position there is a 12A group. There also one hydroxy group is present. This is the basic structure of tetracyclines. If you will practice this general structure of tetracyclines and you will remember the R1, R2, R3 and R4 positions, then you can write the structures of various tetracyclines easily during exams. Now we will see the structure of tetracycline, chlortetracycline, oxytetracycline, minocycline and doxycycline. The basic structure is the same for the all the tetracyclines. Only you have to remember the R1 position, R2 position, R3 and R4. For tetracycline, there is hydrogen group at R1 position, hydroxy group at R2 position, methyl group at R3 position, hydrogen group at R4 position. For chlortetracycline, the name chlor indicates what? Chlorine group is present. Where the chlorine group is present? The chlorine group is present at R1 position. So, only chlorine group is extra. Other all the groups are same like tetracycline. R2 hydroxy group, R3 methyl group, R4 hydrogen group. Oxytetracycline. For oxytetracycline, oxy indicates one oxygen group is extra compared to tetracycline. That is, hydrogen atom is same. R2 group hydroxy group is present, and R3 position methyl group is present, and at R4 position hydroxy group is present. For minocycline, mino indicates dimethyl dimethyl amino. In amino group, remove A, amino is present. So dimethyl amino group is present at R1 position. Remaining all the positions, hydrogen groups are present. R2, R3, R4 are hydrogens. Doxycycline. In doxycycline, there is a hydrogen atom at R1 position, methyl group at R2 position, hydrogen atom at R3 position, hydroxy group at R4 position. So these are the various drugs under tetracyclines. Now we'll see the mechanism of action of tetracyclines. These tetracyclines inhibit protein synthesis by binding to the bacterial ribosome involved in the protein synthesis process, that is protein synthesis process, and shows bacteriostatic activity. What these drugs will do, they will inhibit the complete protein synthesis which will takes place in the bacteria by binding to the bacterial ribosome which will involved in the protein synthesis process. Then they will inhibit the growth of the bacteria, that is bacteriostatic activity. Static means stops, it will stop the growth of bacteria. These drugs, they will bind to the 30S ribosome and it will inhibit the protein synthesis. The 70S ribosomal bacterial ribosome particle is made of 30S and 50S subunits. So out of these two subunits, 30S ribosomal subunit will bind with the tetracycline drugs and then it will inhibit the protein synthesis. The 50S subunit will combine with the 30S subunit and mRNA complex, and then it will bind to tRNA for transfer RNA for building the protein chain. So which is the termination process. So tRNA contains two binding sites. One is P site, another one is A site. P site is peptidyl site, A site is acceptor site, also called as amino acyl site. So these tetracyclines reversibly bind to the 30S subunit at the A site, acceptor site, to prevent attachment of amino acyl tRNA, which will terminate the translation process, that is protein synthesis. This is the mechanism of action of tetracyclines. This is the diagrammatic pictorial representation of mechanism of action of tetracyclines. mRNA, messenger RNA is present, that is 30S ribosomal subunit which is binded with the tetracyclines, and this is 50S subunit which is going to bind with the tRNA. This binded 30S ribosomal subunit with the tetracycline drug, it will go and bind to the amino acyl tRNA unit, which will stop the protein synthesis. We'll see the uses of tetracyclines in detail. Uses of tetracyclines are, they will use as a broad spectrum antibiotics which are used in treatment of various types of infections. They will be used in the treatment of eye infections. They are the low cost alternative antibiotics, but the side effects are more compared to other antibiotics. Recently, tetracyclines are used to treat cancer patients also, to treat respiratory infections, ear infections, intestinal infections and sinus. Tetracyclines will be used. To treat gonorrhea also, tetracyclines will be used. Tetracyclines are not used to treat viral infections. The various side effects which can be observed when the patient have used long-term tetracyclines, then the various side effects are nausea, vomiting, diarrhea, teeth staining or teeth coloring will occur after long-term use. White patches on the skin can be observed. Vaginal itching or discharge can be observed. Trouble in swallowing, which is called as dysphagia, loss of appetite, and jaundice can be occurred. Jaundice can be observed. Precautions to be taken while using tetracyclines are: complete the course of prescription. If the prescription is given for 5 days or 10 days or for 1 month or for 15 days, then you have to complete the course of prescription. Without completing the prescription, you should not stop the tetracyclines. Pregnant women should avoid tetracyclines which will affect the teeth of fetus. Take on empty stomach with plenty of water. Tetracyclines should be always taken on empty stomach with plenty of water. Tetracycline should not taken with milk, antacids and iron, which will affect the absorption of drug. Avoid exposure to sun. Tetracycline should not be given to children below 8 years of age. Tetracyclines passes through breast milk and affect the bones and teeth in babies. That's why we should not give the tetracycline prescription for the pregnant woman. This completes tetracyclines. Thank you.